Good evening, I'm Sean Maroney.
And I'm Sharon Tazwell. A person from North Carolina has been infected with the Zika virus. Health officials say they're keeping a very close eye on the disease. WNCN Investigates has been following this issue closely and has more on what you need to know. Jonathan.
Well, Sharon, it's the first case to pop up in North Carolina. The good news is the person did not get the virus from here. They traveled to an area where Zika is widespread, but health officials are taking precautions.
We have a person who traveled to an affected area for Zika who is tested positive.
This tiny bug is causing a big problem.
The physician contacted us and we arranged testing through CDC.
Health officials can't tell us who or even where exactly this patient is, but North Carolina now joins 22 other states that have confirmed cases of Zika from people who ventured outside of the U.S.
Is this something that you guys expected?
Absolutely, yes. We have lots of people who travel in our state, and there are a lot of affected countries, and that's why we've been wanting to get the message out to all North Carolinians. When you travel to a country that's affected by Zika, you need to protect yourself from mosquito bites.
That includes bug spray, wearing long-sleeve shirts and pants, and making sure screens are in place. The CDC says only about 1 in 5 people who catch the disease will even see symptoms. Those include mild fever, skin rash, muscle or joint pain, and pink eye that usually clears up in a week.
As a disease that you get yourself, it's not as bad as some. It's more our concern that it may be associated with birth defects that has us cautioning people.
Children being born with disfigured skulls has been reported in areas where Zika is rampant, but the World Health Organization is still studying the connection. Researchers say the type of mosquito that can carry the Zika virus is found in every county in North Carolina, but at this point, state officials don't expect any outbreaks.
We don't really anticipate Zika virus taking hold in this state based on our experience with dengue virus and with chikungunya virus, which did not become transmitted locally.
So again, if you take your kids outside and one of them gets bit by a mosquito, health officials say it's extremely unlikely that they'll get Zika. Now, we also learned that in 2014, lawmakers virtually cut all funding for mosquito control and tracking at the state level, but DHHS says it's currently restructuring its resources to make sure they can start it back up again. Sharon?
Well, there's currently no vaccine for Zika, but the CDC says it is a top priority. If you have something you'd like our Investigates team to dig into, send us an email to investigates@WNCN.com.